name is Andi Giri. I am the managing principal at Softsquare. We all know that all of us have been impacted by this dreaded virus in the last few months. And we as knowledge workers have been fortunate to be able to manage this through this crisis and ride over this tide. The presentation today is about reopening. The reopening tools and tactics using Salesforce Work.com technology. And we as a service provider working under the Salesforce ecosystem are going to deliver a series of webinars and clinics in this series. We are also offering free clinics as well as discussion during and after this presentation. As you all know, Salesforce has grown leaps and bounds since their founding in 1999 with 63 acquisitions and various tools in their Salesforce ecosystem. Likewise, our business has also grown since the last 12 years. We have initially focused on Sales Cloud, Service Cloud, and Force.com platform. But over the years, particularly in the last 3 years, we have built practice areas around various aspects of the platform, including CPQ, B2B Commerce, MuleSoft, Work.com very recently, and as well as very important visualization tools, which are Einstein Analytics and Tableau. So we would like to focus today on Work.com and certain aspects, which I'll explain very shortly. After the next slide. We were rated among the top 20 product development organizations in the world in the last Dreamforce of 2019. I would like to highlight that. Next slide, please. We also have been practicing in various verticals: consumer goods, healthcare, financial services, manufacturing, education. And of course, we have done 33 products for the App Exchange. We have practice areas both in technology and vertical of Salesforce's ecosystem. We have several customers that we have acquired in the last few years. Johnson Controls is our top customer, enterprise customer. Adobe is our customer. Coherent, a large laser equipment manufacturer out of San Francisco area, is also a customer. And we also have British American Tobacco as a customer through our product alliance with IV Mobility, a consumer goods product leader. We have strong expertise in building products as well as SI implementations in the Salesforce ecosystem. And of course, we have our focus area today, which is Work.com and visualizations using Tableau. We have our data scientist, Alexander Peter, who's helped us provide this presentation and all the technology and needs for this seminar, which will continue in the next 2-3 weeks. He would explain with a dashboard how to reopen your office using Salesforce technology. After you, Alex.
Thank you, Mr. Giri. Great. Good afternoon and good morning and good evening for everyone in the call. So glad to have you. So our focus today is, as Mr. Andi mentioned, employee health screening. And the next upcoming seminars, we're going to focus on shift management tools and contact tracing. We have some very innovative methods to do contact tracing, and we will be presenting that in our upcoming webinars. So joining me today in this presentation is our sales engineer, who's going to actually walk us through the screenshots, actually the live application. And also I will be walking you through the Tableau live application, and the sales engineer is going to be walking you through the Work.com application from Softsquare. So let's get started. We are going to take a look at a case study. Why are we doing this? This is our purpose. So what we did, we looked at the Work.com command center. Let me show you that real quick. We looked at it, and we felt this was a very compelling, a return to workplace application. And we wanted to, help our customers, partners, and community by deploying this Work.com dashboard. But when we looked at it, we saw some gaps. We saw gaps in shift management, and we saw gaps in contact tracing. And mainly we saw a gap in the health screening space. So for instance, take a look at this visualization. This is a screenshot from the Work.com Trailhead Work Center module. So if you look at this particular screenshot, you can see how there is a disconnect between the location workplace status and the COVID-19 tracker. So essentially, when we looked at the work.com architecture for this, we were trying to map the location workplace safety status of our employees with the COVID data, but they were in two separate applications. One was in Tableau, another one was inside of Salesforce. So what we decided to do was, if there's a way we can blend and have a multi-layer where you can lay the health data and the COVID-19 data one on top of another, how would it look? So when we started researching, we kind of stumbled upon this old 1854 graph for the cholera map in London. This is in Broad Street. So one of the doctors, Dr. John Snow, went and mapped all the patients just like that, if you see the zoomed in version on the left side, by just using dots. And then he was able to identify the root cause was a pipe that was broken and going into the sewer, and that's how this whole outbreak started. And it's such a simple way to look at a very complex problem. And this, I think he was considered the pioneer for disease mapping on top of a map like this. This was very early on. So we thought, is this something that we can take from this and try to do it ourselves? So that's our kind of motivation. Now, if you think about it, the challenges that he faced in 1854 is very similar to the challenges we're facing in 2022. We're still having problems mapping this health data on top of a map. So now Tableau and the rest of the Salesforce ecosystem makes it a lot easier. Okay, so let's get started. We're going to start with the health screening. That is the first step for reopening. And the health screening essentially starts with a set of questions that you get. And then as you submit these questions, and each employee through email or through a link on the web or through a text message gets a survey, they answer the survey, and that response gets stored in the Salesforce. And also the managers have a workflow to see how many of their employees are well and ready to come to work. There are a lot of privacy and compliance challenges that you'd have to deal with. Do we capture all the responses from the employees? Is there a PII? Is there some kind of a regulation that we have to follow? And so taking all that into consideration, the lowest common denominator is to just not capture all the results from the questions for each employee, but just focus on the last one, which is the outcome. Yes, I have a symptom. No, I have no symptom. And then just kind of moving forward into the result. And then only storing employee, fail, pass, rather than storing all the other details, such as have you traveled international? Have you met with someone else who may have COVID? All those different questions from CDC and other health organizations can be asked in a survey, but we can choose not to store it in the system. It's all up to how your organization functions. So we can customize it however you like. Also, one of the interesting parts of the survey is we have added something called overall wellness. And this is kind of, once you're done with all the survey questions, it brings up this one screen where it asks you, how are you doing? And this is kind of a psychological, behavioral safety, workplace safety question. So it's just asking to make sure you have a good sentiment. Are you on a negative side or a positive side? Based on that, we could have your HR health officer or a guidance counselor reach out to you for counseling. So once you've filled all this out, and then it's an optional selection also. Once you've filled all this out, you click submit. And then what happens from there is this data gets loaded into Salesforce. Now what we're going to do is we're going to take a look at a live demo of Salesforce, and we're going to take a look at different components. This component has location, this component has a little bit of contact tracing, and the employee health screening. But in this presentation, we're just going to focus on health screening data. So once we look at the Salesforce screen, how this is all put together, then we're going to go right into Tableau and show you how we blended the data from Salesforce, blended the data from COVID-19, and brought it together using Tableau, just like Dr. Snow's disease mapping. Okay, so now I'm going to request our sales engineer, Kanmani, to go ahead and share her screen and give you a quick overview of the command center, which in this case is the screen you're looking at. So we're going to do a live demo now. I'm going to stop sharing and then she can share. 1 second. Okay, so now Kanmani, if you're on the call, please go ahead and let's do a live demo. And as she's doing the live demo, I want to kind of walk you through and kind of explain a few points and few vocabulary. And later on at the end of the presentation, if you have any questions, we can get started.
Yes,
okay,
yes. Go ahead.
Great. Welcome. Good morning, Kanmani. Go ahead. And so this is the workplace command center. And if you look at the left side, which is the location workplace status. So what we're going to do now is we're going to go ahead and take a look at the actual definitions. You can see we're going to go through each block. So let's start with the first top left block, which is the workplace safety status. And we're going to look at the statuses on that particular screen. So if you look in the bottom, there is something that says open, reduced density, soft close, and hard close. So these are the statuses for each of the locations. So it's open, that means that place is open, there is no violation, there is no threat for any disease or infection. Reduced density is that the site is open with physical distancing restrictions in place and a limited number of employees can be present at any given time. This reduced density is enforced using shift management and contact tracing. Then the soft close, the site is open, employees are encouraged not to enter the building, but they can still get in and won't be forced to leave. This is, for instance, to pick up some of your items from your desk or some kind of a temporary way to get in and out of your office space. Now, when we look at the COVID-19 dashboard, the Tableau dashboard, you can see why soft close can be predicted based on the data that we have. And then finally, the hard close. Again, this is where it has been identified that there is a high chance of exposure in that location, or that particular city has a high exposure rate to COVID-19, and then essentially it's shut down for regulations or whatever reason. That place is hardly shut down. So as you can see, the different sections. Can you look at the list view, please? Kanmani, can you go to the list view, please? Okay, so if you look at the list view, it kind of gives you a better, sometimes it's important, visualization sometimes is distracting. Like looking at a map may not give you the full picture. So here, looking at it on a list view, you can clearly see how many locations are closed, how many locations are open, and how many locations have not been reported. Like 2 of them have not been reported. So the health officer can go out there and say, hey, we need to reach out to someone in those locations to update the status. Okay, let's move on to the next one. And this is the wellness status by location. So this is again a more aggregate level, Washington, Boston, and you have the percentage that took the survey in those locations. So this is where if you have different departments or different locations, you can track them in this fashion. So you can see that, okay, in Washington, only 27% took it, and in New York, only 13%. And then you can send a note or a more stricter alert. So this kind of gives you a way to monitor how well your team is taking that survey. Remember that health survey, how well they're taking that survey. Then going to the right side, this is very interesting. So what you're looking at here is based on that survey, the wellness status survey, you can gauge how much of your workforce is ready to come back to work. And this could be consent from them, filling out the form and saying, I'm okay, no symptoms. So you can see available to work. Some of them may even check saying that, you know what, I'm comfortable, but I don't want to come into work. I can work remotely, but I can't come into work. So there are folks who are saying that. 74 employees have opted out for a remote work. And a few of unavailable and unknown. That's the standard data outliers. So as you can see, this is a one piece of data that we use to calculate shift management and contact tracing. So that's important, because when you look at shift management and contact tracing, without getting the consent and the availability of your workforce, you won't be able to do those two. So this is kind of a starting point. The health screening and health survey, those are the starting points. And that's why we started our webinar with this, this section first. Okay, could you scroll down, please? Okay, at this time, you can see the wellness status by location with a percentage and kind of giving you some type of utilization. 37 by 37 for park, how many employees have are coming in, available to work. It just gives you a much more granular view of that data that you just looked at on the other slide. Now going to the next slide, this is very interesting. This is your sanitation and cleaning crew. You know, they're going to go ahead and fill out another survey that tells them, hey, have I cleaned the kitchen? Have I gone in and done this? So we can set up the schedules. We can set up every 15 minutes. The utilization for a kitchen it was 15 employees, but now it's only going to be 5 employees with social distancing of 6 feet from each other. And then every 15 minutes, so you can have a time from the lunch time is between 12 to 12:30. And then from 12:30 to 12:45 is cleaning crew time. And after cleaning crew is done, then the next shift opens. So you can have this very clean, strict schedule so that it's consistent and the cleaning crew can come in, clean the tables, clean the microwaves, make sure everything else is clean in the dining area. And you know, it may seem like an overkill. It may seem like, oh, we're trying to do too much for such a short term. But I think if you look at soap and if you look at evolution in the history, there was a lot of things that looked very odd at that time, but at this time it's kind of normal. We just use dishwashing soap and we do a lot of different sanitation techniques that, you know, prior to that may have looked odd, but post doesn't. So in the future, these may be the norm of social distancing and maybe social decency. I'm not sure how this is all going to pan out, but at least these tools can keep your employees safe at the workplace. And at the very end, we just talked about the employee risk by location. This is very straightforward. So you can see each location. If you look at it, it tells you at-risk employees are 28 and move to the F5 tower. You can see 25. Now, this is the benefit of bringing in the COVID-19 data. So if you're in a particular location that has a high COVID exposure and you're walking into your office from that location to the office, even though your office is in downtown Washington, where there is less exposure, but you're coming from Baltimore, which has a high exposure. Now you may take the public transportation, you may meet with other folks along the way, and you could carry that virus to the office. And that's where this at-risk employee exposure can be gauged. It can be gauged in 2 ways. It can be gauged by looking at public COVID-19 data. It could also be gauged by the employee health survey data, and maybe the health officer goes in and manually adds that risk indicator, risk factor. Okay, so saying that, I think this is kind of the live component. Kanmani, do you have anything else you want to show on the screen that would excite them?
No, Alex.
Okay, great. So this is kind of very straightforward, operational, not strategic or not tactic, maybe tactical to a certain extent, but very strategic and operational data. Now, if you were to look at this visualization here, and if you scroll down, you can actually see the Tableau health screening dashboard. Most of you have probably seen this before. It's in their demo. And this is a data that they bring in using a software, using a data loading software called MuleSoft, and that's part of Salesforce. So we have worked with MuleSoft, and we have expertise in the ESB, Enterprise Service Bus, and ETL. So we extract data using MuleSoft and bring it in. Now, if you think about it, we're just doing this for the COVID-19, but you can also use a similar architecture to bring in marketing data, CBI data, customer price index data, economic data, Wall Street data. So you can really blend the data with your Salesforce data to have an enriched visualization. And that's kind of the bigger goal, is to enrich the data. Okay, so I think I'm going to go back to our presentation here from my side. Kanmani, thank you for your time, and thank you for putting this presentation together. Thank you.
Thank you, Alex.
Right, we're going to the other slide. We're going to take a 30-second break.
We're deeply honored to have Chris Bellis, President of Diplomatic Language Services, one of our premier clients from 2015. Welcome, Chris.
Thank you for the invite. It's great to be here. Appreciate this.
Okay, thank you very much.
Thank you, sir. Okay, so we're back and we're going to get started with this. So we looked at the live wellness status demo. And also, for those of you who joined late, just quickly, we wanted to kind of show you the gap, right? So we were talking about the gap analysis. So when we looked at the gap here, the connection between the Salesforce data and the COVID data or external data and blending them together was something that was missing. And that's something that we're trying to look in this particular webinar. So, okay, we looked at this and we looked at that. Now we're going to look at the architecture. So the way we blended that data from Salesforce employee survey and the external COVID-19 data, bring it together in a map, in a multi-layer. That was done through this data architecture, which is we have the data sources coming from CDC, news agencies, and other organizations, which is all being pulled together using the MuleSoft Anypoint platform. And in the future, we probably have another webinar, maybe even a clinic to just kind of go over that. It's a fairly complex way to, to blend all that data together using the MuleSoft Anypoint platform, which is a Salesforce product at this time. So now they bring it all together using this platform. It gets loaded into something called an operational data warehouse, again, part of the MuleSoft Anytime platform, which that particular warehouse is something called HL7 and FHIR compliant, which means it's HIPAA, PII, and other GDPR. It's compliant database, which has auditing, security, encryption, privacy. All those are kind of baked into that system. So that way you're anonymizing the data, and there's kind of all these regulations around privacy being enforced in that database. So once we load this COVID data there, and then from there, we will load that data for visualization. So we're going from data accessibility to data enrichment, right? So our goal is we're moving right from there, the ETL process, essentially, the extraction, the transformation, and the loading. Essentially, that's what this is doing, is the data pipeline. So we move from the data warehouse to Tableau Public. But to just move it to Tableau Public is a free Tableau application which does not connect to a database directly. So since we're using the free Tableau Public software, we're using another Tableau product called Tableau Prep, which would connect to the data warehouse and convert the data into a format that Tableau Public can read. Because it would be easier to directly connect the Tableau to the data warehouse if you had the licensed Tableau desktop version. But since this is a Tableau Public free version, which journalists and schools and universities can use for nonprofit, it only connects to an Excel file or a Google Sheet, or it doesn't connect to a database. So we're using this Tableau Prep as an interstitial to connect between the data warehouse to the Tableau Public. Now that is the framework for how we got the COVID-19 data. The one at the bottom, this is our Salesforce core component that puts the employee health survey together. So this employee health survey is a combination of this new employee object and the survey object and the location object. And of course, the employee crisis assessment object. So these are all the different objects that you find in Salesforce when you pull down work.com for the reopening initiative. So these are the different objects. And then what we did at the bottom right, we took the data from the top and blended it with this data. And the key that connects to it at this time is the employee location zip code with the data hub. You could have a country or zip code. In this case, zip code seemed to be a good match for us, so we plotted it on a zip code. Okay, so now that you've seen this architecture, we are going to go right into the live demo, which is going to be here. And also what we're going to do is in the chat, our marketing manager is going to send you a live link so you can click, you can look at it live on your screen while I'm showing you the demo. Sridhar or Purnima, could you chat to everyone on our log the Tableau public dashboard link, please? Again, this is not real data. We anonymize the data. This is our internal employee data. So there's no PII, or we're not sharing any information. And in reality, you would not even publish this type of data on Tableau Public, because this could have employee PII data. The name itself at this point sometimes is considered PII. Okay, so we're going to take a look at the live demo. As I'm doing, you can also walk with me and we can have a walkthrough. So this is the Tableau link, which is Tableau Public. It's called public.tableau.com/profile/Softsquare, if you're familiar with that link, or we're going to send that through chat. Let's make sure that everyone has gotten it. And once everyone has received it, we will go ahead and get started. So I'm going to walk through. So watch your chat in Zoom to get this, this link. Okay. So what we've done here, this is our, just for those of you who are familiar with Tableau, Tableau has something called story points, dashboards, and reports. Dashboard is a combination of reports, and story point is a combination of dashboards. So it's kind of like goes in this way. So if you look at it, think of dashboard like an Excel, a full Excel file, and think of the reports as each tab on that Excel file, right? So it's kind of a separate segment. So in this case, the first screen is just a story point where we just have the presentation slide embedded in it for you. So for those of you who want a presentation, it's right there embedded for you that you can use. And then the second tab is the blended dashboard. As I mentioned, dashboard is a combination of small micro reports. So this number here is a micro report. This picture of icon with the fail, all these are small micro reports that are all put together to provide you this visualization. Now, if you take a look at this visualization from the top left, you can see we have, yes, I have symptoms, and this was a response. 8 of them have filled out that employee survey, and they have symptoms. And 12 of them have no symptoms. And these are the list of employees. Again, some of them may not have had zip code, so they're not plotted in the map, but you can see what their results are. As you can see here, I'm red, and this is, if you hover over it, you can see the information that I have, the date and time that I took it, and the zip code. And this can happen every day. You can have a max date and we'll pick up one every day in the morning just to see how your team is doing. So this kind of gives you a high level strategic dashboard. Now, on the right side, you can see, and this is where it gets really cool. When we looked at the traditional Tableau, which is here, you can see how they plotted, and they just used the bubbles to see how many of them were confirmed, how many deaths, how many new. It kind of provided a little bit holistic view on the actual, all the actual virus stats. But there was no other data blended in, like there's no employee data. It was not contextual. This was kind of like a general dashboard, right? A general dashboard that you can find anywhere. You go to Google Maps and search for COVID-19, you could get something similar to this. So this was kind of a general aggregate of that COVID-19 data. What we did, we took this data and we enriched it, and that's what you're seeing here in this blended dashboard is an enriched version. Now, as we enriched this data, let me go ahead and give you a higher, like a more clear version of blended. This is just a map. I just wanted to make it full screen so you can see it clearly. Now you can see here, if I move my mouse over Colorado, you can see there's a 35,000 positive case count. And if I go into Newark, there's 403,000. That's the color coding where you can see the lighter, the green is between, and we have a legend here at the bottom. You can see that'll tell you the actual right here. So 1,000 is really considered green, and 400,000 is considered red. So we have, this is just kind of a legend here. So you can see, you can actually drill into so much detail with this map. And you can blend in so many other pieces of data in this map. And I'm going to show you that later in this presentation. So you can see how there's 2 folks blended together, you can see they're in a very close zip code. It kind of adds this kind of a backdrop. And then as you keep zooming more and more, it's going to keep splitting, and you can see them kind of spreading apart. The reason I want to show you this, it's kind of a tool, kind of a limitation. And that's why what we have done, again, in real time, it's bringing in the cities, the streets. This is, again, our motivation was, if we wanted to do something like Dr. Snow from 1854, we wanted to have something better. We wanted to have some kind of a proximity grid and, different alerting mechanisms than just looking at it. And that's why we even included the data from the dashboard as a tabular data. And it always helps to have that tabular view, because it's hard for you to study and look at a map when you have 600 users. So you can segment them, you can filter them, but the biggest benefit is you can get a report like this, where you can actually look at it. And this could be by location. If you click, this whole thing can filter for that location. So you can just set up all kinds of filters and customized views for different departments. So every department can get this report in their email in the morning just by looking at their staff, not everybody else in the organization. So you can get very creative with the way you can use this tool. And again, here's a quick view of the employees. Sometimes you don't want to see no symptoms. You only see the ones with the symptoms. You can filter out, you can click and filter out, and you can do all kinds of drilling and dropping. Now, one more thing I wanted to cover, and this is something going deeper into Tableau, which is I'm going to bring up the Tableau desktop. Now, to do this work, to blend and get all this working, you need a license for Tableau desktop. It doesn't work without Tableau desktop, because Tableau desktop is the application that can connect to Salesforce. The Tableau public is a free version. We can use it for schools and things connecting to a spreadsheet, but it does not connect to the enterprise solutions like Oracle database or SQL Server. Okay, so now looking at this one, this is the screen. I know it's a little small to read everywhere, but the focus is I want to show you some cool features. So for instance, let's say this map, this color is something you're colorblind or you don't like the color. You can always go in and fade it out. And give it 1 second, it's just computing. So you can see how it's faded out real light, or you can just make it really dark, like that. And not only that, you can also plot in other pieces of data in these data points. So when I mouse over, you see where you can see just the positive cases. You can also look at the death rates, and you can look at other details, the population, the GDP. You can overlay so many other pieces of data, and that's what I want to show you next. Is let's say I want to keep it here. I know it's lighter, darker. You can change the color parameter. If you don't want red and green, you can go in and change it to all these different gradients that you want. And now let's say we're going to look at this feature, which is this is called the map layer feature. There's something called washout. And if I do a washout, look what happens. I wash out the blue and everything else outside of this map, so it doesn't look like it's overtaking it. Like if you look here, now if I don't wash out, you can see too much of the blue, other details from the other locations. You can just wash out and just focus on your data. Now, if you feel like the city names are lower, we can make the font size bigger, change the color for that. So this is kind of called a washout feature. Now, as you can see, it's not clear. To make it clear, you can go in and instead of outdoor, you can do dark. Depends on your preference. You can actually go in there and change the backgrounds and do a full washout and make it dark. It's taking some time to render. Oh, that's my Cortana, sorry. Okay, so, and then if you look at other ones like streets, light, normal. If I do light, it would go that way. And then I can go in and make the opacity more. So you can kind of play with different options to see which one fits you. And obviously sharing it from this screen, it may be hard for you to see, but you can really make it opaque. So you want to just see your employees. So it kind of pops out all your employees if you just do it this way. And try to take advantage of the hovering over and kind of managing it. You could have different versions, one for print, one for a big screen on your hallway, one on your website. So you can have different versions depending on how you want to do this. So, and also what you can do is you can remove terrains, you can remove coastline, you can add components as well, such as you can add US population, age, female, male, the household, the census data, the US occupation, the housing units, population by race. So you can have all this data overlaid on top of this one. So if I wanted to go ahead and overlay, let's say, population, I can go ahead and do that. Let's say US age median population. Now at this point, the map just switched from COVID-19 overlay to the population overlay, and you can see based on population, which state's doing, and you can adjust the colors accordingly, and you can even put labels on top of it. So that's how it works. Now, also, as you can see, the icon of the special, like you can, I can make these icons bigger, so you can see the people much bigger than it is. You see how I can expand that? And sometimes if you're colorblind and you can't see the difference between the blue and the red, you can always change the icon to a shape. Instead of, you can have one shape for the blue, another shape. So you can pretty much choose what icons you want to do. Let's say if you want to do a circle, you can do that as well. Obviously, you know, just kind of bubbles it up. Now you can also have different shapes, one for affected, one for not affected. And that's kind of the preferred one, is to have two different shapes instead of actual people, because of if you print it in black and white, you won't be able to see the differences. Plus it's very distracting. And also you may want to wash out your map because you may not be interested in the coastlines and the terrain and things like that. So you can adjust it accordingly. So that essentially is just the Tableau. All we did was we connected, and we were, our team was able to put this together in a very short period of time. It did require some understanding of this architecture, which is going back to the presentation. And Mr. Giri is going to talk to you about it, and he has made a commitment that we want all the community to do this. So we have a free clinic where we can show you how to do this. This is something that Softsquare believes in, is helping and giving back. And so we are going to be having free clinics for you to do this. We'll give you the code. We'll show you how we did it. We'll help you get to this state so that you can, your organization can have enriched data. Now, going back to this one, we looked at this. So let's go ahead and take a look at the next one. Now that we have looked at this, let's go ahead and take a look at the future architecture, because now we're looking at shift management and contact tracing. So when we do that, we may be moving outside of Tableau, and we may be going into the Salesforce work.com. So if we do that, we do need a way to inject the COVID-19 data, CDI data, other pieces of data into work.com. And that's where I think the strength is you can take this COVID-19 data and put it into the work.com. And from there, we can manage shift tracing, location management, and others dynamically. Now we are moving from visualization to actual operational efficiency. So we're looking at those data, enriching it, and going right in. And in the future, government regulations, closings, all those could also be brought in dynamically, so your HR officers can really manage it seamlessly using this MuleSoft Anypoint platform and integrating with these other data sources. So think of it from a broader perspective. This is very powerful. Okay, saying that, I think we have come to the conclusion from our perspective. Now what we would like to do is have Mr. Giri, talk about our free consultation, and also he's going to quickly talk about the work.com framework a little bit. We're going to touch this on our next webinar because this is focused on Tableau. We don't want to go deep into this, but we also have some product pricing and some strategies. We have been constantly looking at it to see how do we make this accessible to our clients? How do we fix this pricing matrix? It's still in the works. Salesforce is still putting together different components, and they're mixing and matching different components. We are also trying to get ahead and try to understand and try to look for this packaging, and we'll try to help you with that. Saying that, again, thank you very much. My name is Alexander Peter, and I will be also helping with this clinic. I've been a data scientist for a good amount of time, but before a data scientist, I was a data engineer and a visualization architect. Has been in the industry for over 20 years. I've done a lot of work, but this is unprecedented times, and trying to get on this and help everyone reopen successfully. That's one of our goals. So we will be here to help you. Mr. Andi, I think I'm done. And then we'll open up for questions after Mr. Andi is done. Thank you.
Thanks, Alex, for this wonderful presentation. I'm sure the audience gained a bunch about how to leverage work.com as well as Tableau in the particular aspects of workplace readiness and employee wellness. And of course, in the next few weeks, we are going to delve into shift scheduling and also contact tracing. And we're doing a bunch of work, and we're starting to do work.com work for a few of our clients now. And of course, the 1 hour clinic, we'll send you email, and you can reach out to us for one-on-one sessions. I would open the floor for questions at this moment.
Great. So we have a question about Tableau Public versus Tableau Desktop. What is the difference? So the Tableau Public is a free version of Tableau that they're using in schools and news agencies. It's a free download. You can search the web for Tableau Public, and then you can download it. It's the interface and the functionality is the same as the Tableau Professional. The only thing is the data sources that you can connect to. And when you try to save Tableau Public, you can't save it on your local hard drive. It needs to be saved on the free Tableau Public website. So essentially, the data that you have is exposed at that point. So it's essentially a Tableau's way of giving a free version for public data. And it's free to open. And the Tableau Hub, that's what they call it. And I can quickly show you here how that looks. If there's any specific question to work.com, please let us know. I'm looking at the chat logs. In the meantime, let me just show you the Tableau. So the Tableau COVID-19 Hub, if you search for that, it is a free version, just like we're doing the 1 hour free clinic. The Tableau community is doing their free part in trying to give this data for free. And that is phenomenal that they're using MuleSoft and all these components, and they're actually giving you a starter workbook. Let me zoom in a little to show you. So you can just get started. Sridhar or Purnima, can you send this link to the chat to everyone in this call so they know what it is? It's the Tableau. Actually, just send that link.
There's another question about licensing. I will answer that question. Work.com licensing particularly. The Work.com as a product has been around for a while, but the Work.com for reopening was launched in May, was developed in May, June timeframe and launched early June. It involves a bunch of different products put together. Apart from the Work.com package, which sits on Force.com, there is also a need to have field service lightning to be brought in as a package, which provides the shift scheduling component. There's also what Alex just demonstrated, which is the Salesforce Surveys. There is Tableau for visualization, and also surveys for the employee wellness check, and Tableau for visualization. Of course, for the last one, which is the aspect of contact tracing, you would need the Health Cloud as an underlying component. And there is a few other packages also. We could delve into it in more detail in the next webinar. Thank you very much for all of your time, your precious time to attend our webinar. Let's all meet again next week. Thank you.
Great, thank you everyone. And please feel free to reach out with me. I'll be in the 1 hour clinic, so you can come in and we can talk more in detail on how to leverage work.com, the health screening survey, and all these different components. As you can see in that slide, it is a buffet. It is a buffet that we need to choose exactly how we want to approach this. And we're trying to create different solutions, different packages, and we're trying to figure out how everything fits together. And I think we have a fairly good idea how to do the shift management, contact tracing, and the health screening. So thank you again, everyone, and thanks for the call. Stay safe. Thank you, Chris. Thank you for the clap. Okay, folks, we will follow up with an email with the link for the 1-hour webinar. There is a quick way for us to track the webinar. So we do have a code, which is called S2-help. So if you please use the code S2-help when you register so that we know that you come from this webinar. It's just a way to track that. Okay, thank you very much. At this time, we're concluding, and if there's any questions, please feel free to reach out to us through email, or we can reach out to you with a follow-up email. Thank you.